Hi, Vitality Seekers. I want to share with you a concept today that I think will help us really understand what is going on, one of the many reasons that is driving our health crisis and healthcare crisis. And that concept is health insurance is car insurance. Okay, so let me break this down for you. Car insurance. When do you want to use your car insurance? Does anyone want to use their car insurance? No. What is happening to your car when you're using your car insurance? The car is broken in some way. And a lot of times the premiums are going to go up then too. Another negative. But do we need car insurance? We definitely do. We all know that. We've all grown up with that idea. It's a universal accepted idea that we definitely need car insurance. Now, let me ask you, if you want your car to have longevity, do you need to invest in prevention and maintenance care like oil changes, annual checkups, fluids, wipers, tires, alignment? Do we need to invest in those things if we want our cars to have longevity? We definitely do. And does car insurance pay for those things? It doesn't. But we all understand and agree it's important if you want your car to last. Okay, so universal agreement on this scenario, but let's look at health insurance. Health insurance was literally built the same way as car insurance. And so, what does health insurance actually pay for? Nowadays, it really just pays for pills and procedures and really things that we hope you'll never need, like when your body is broken. So, in this case, your body is the car. So, when your car is broken, health insurance kicks in and it pays for things. It's really important for things we can't predict, accidents and injuries, just like car insurance. We definitely need it, but the question is, does it cover and pay for preventative things, maintenance things, other than screens, if you will? Does it really pay for and value prevention and maintenance? I would argue it covers screening to make sure you're not dying, but it does not cover the things that will really move the needle and help us actually get longevity in our bodies and our health. And yet, we all understand health insurance is necessary, just like car insurance. But somewhere along the way, doctors and patients alike all got convinced if health insurance doesn't pay for things, then we can't do them because we can only use health insurance. That's it. That's the only way to take care of our health and our bodies. But if we want longevity, it makes sense we're going to have to invest in the maintenance and prevention, just like our cars. And I would argue that if it's really important to maintain our cars and to have car longevity, I would actually argue that investing in longevity of our bodies and our health is even more important, because if you don't have your health, can you even drive your car or do your work to your best abilities or really do anything in your life and enjoy anything in your life to the fullest of its capacity? I would argue that you can't. And so if our cars are really worth investing in for longevity, again, I think that our health and our bodies are more important to do that. So I wanted to start with this concept because if we can understand what's happening here and use health insurance for what it's there for, like car insurance, and understand that if we want our health back, we're going to have to take it into our own hands and work on our own health without being limited by health insurance, that's going to open you up to a lot more opportunities. And I want you to stick with me because we're going to keep talking about this and other ways that you can actually work on your health. But I wanted to start with this concept so that you actually understand one of the limitations, I would say, of our health care system and our health system right now. So stick with me and stay tuned as we continue talking about this, and I give you more tips and ideas about how you can actually take better care of yourself and work on prevention and longevity for yourself. See you soon.